Okay, today we're going to be talking about everything you need to know about Lyme disease. Now, Lyme disease is a corkscrew-shaped bacteria that typically is harbored within wood ticks, black-legged ticks. There's a few other insects that can carry it, essentially in that arachnid or the spider family. And when that tick gets on you, it'll bite you and it can transmit the bacteria. Now, what's kind of common knowledge about it is, or what's thought to be common knowledge is that it produces a bullseye rash. So this is kind of like a white spot surrounded by a red ring. Now we know that that only happens in about 10% of people, so it's pretty rare. And this is why a lot of people kind of miss the diagnosis or miss going in and getting tested for Lyme disease. Now that tick, the other kind of thought behind it is that it has to be attached to you for at least 24 hours. Now we know that that's not true now either. In fact, it can be transmitted in as little as a few hours as long as it has access to your bloodstream and depending on how that tick is removed. Now, if you go and squeeze that tick and squeeze its kind of stomach contents out of it as you're pulling it out, you can transmit the bacteria that's in that tick much quicker. And so it's one of those things that there's a few kind of falsehoods in this realm, and that's why a lot of people don't get diagnosed properly. Now, what is the bacteria and what does it actually do? So the bacteria is a corkscrew shaped bacteria. It's called a spirochete. And what it does is it kind of travels throughout the body and it kind of spins, and that's how it moves. So it has a form of movement. And because it has that movement, it has kind of two unique qualities. One is it can travel through the body on its own volition. It isn't required to kind of go where the blood goes. The other thing is once it gets into tissues or gets close to tissues, it can actually burrow into that tissue. Now that's where it gets dangerous because when it burrows into tissues like brain tissue or neurological tissue or spinal cord or knees or joints, that's where we get the pain. That's where we get the fatigue. That's where we get all of these weird symptoms that come with Lyme disease that people often chalk up to, oh, I'm getting old, or maybe I raked the grass for too, or the leaves yesterday too long, and that's why I'm sore. So, anyways, this bacteria will burrow into those tissues. Now, when it burrows into those tissues, it has a couple different effects. One, it has a local kind of inflammatory effect. And the second effect is the immune system all of a sudden is brought to the attention that there is this kind of foreign bacteria. Now, when the immune system goes and tries to hunt it, it creates a bit of a problem because this bacteria is now inside the tissue. So, in order for our immune system to find it, it actually physically has to potentially destroy our own tissue, which starts this kind of autoimmune cascade. Autoimmune meaning like self harm, where the immune system starts to attack its own tissues looking for the bacteria. And we'll get into kind of this post Lyme syndrome and whatnot and chronic Lyme in further talks. But when the immune system starts attacking it, it creates this inflammatory response within our own tissues because there's some destruction of ourself. And when the bacteria is being killed off, it naturally will try to hide from the immune system. And so it has this unique ability to kind of curl up into a little ball. So this spring-like shape or corkscrew-like shape will twist up into a tiny little ball. And we call this a round body or a cyst. And what that does is it allows it to essentially kind of hibernate. And when it hibernates, it can kind of hide from the immune system because now it looks different. You can imagine it's like the immune system is being told, hey, look for a pit bull that's running around the neighborhood and biting kids. And all of a sudden you like walk down the street and the poodle walks by you and you go, oh, well, that's fine. And that's kind of what happens with the immune system is when it curls up into the ball, the immune system all of a sudden doesn't recognize it and then doesn't attack it. And it kind of hides till the immune system calms down or until the person, gets another kind of emotional stress or physical stress in their life where their immune system gets weak and the bacteria kind of pops out and plays. So normally the symptoms that we would see in Lyme disease, at least in the beginning phases, is uh, joint aches and pains, headaches, fatigue, usually one-sided kind of pain. So you can actually get kind of like a sore neck, but just on the one side. You'll see sometimes some weird stuff show up in the regular blood work, but just nothing crazy abnormal. Maybe a little bit increase in anti-inflammatory or inflammatory markers, maybe a little bit of an increase in certain white blood cells. And the pattern that we typically see is after you get the bite, We'll see a couple days where you're feeling off and maybe even a bit feverish, not always. Then there's usually about a month to 3 months where you feel kind of normal again. And then all of a sudden your life starts falling apart. So if you get bit in the month of September, it isn't uncommon for people to get really symptomatic until the months of December or even January. And honestly, as you go further in the United States, you can get bit by a tick in November or December or even January, depending on where you live, and potentially year round. So, in the northern states and in Canada, you would say, okay, the most common time for people to have symptoms with Lyme disease is in kind of August, September, October, kind of towards the end of summer. That's around that 2 or 3 month mark where people start getting sick. But as you go in the southern states, it can be any time of the year. And typically, what you'll go in is you go into your doctor and say, I'm not doing well. I've got all this pain. I've got all this fatigue. The blood results come back rather unremarkable. If you're lucky enough, they will test for Lyme. And we'll talk about Lyme testing in a further episode, but essentially the Lyme testing has some faults to it. And so that's what's really important is recognizing whether or not you took the test, the right test, and if you took the test that's not as accurate, was it during the right time frame? So it's really important that you get tested kind of within, I would say, after a month after the bite, at least in that window up to about 3 months. That seems to be when it's the most accurate. Before the month, the initial month, it can be inaccurate, and after 3 months, it can be inaccurate. So it's one of those things that every lab test has its kind of pros and cons. And so with the Lyme disease test that we have kind of in conventional testing within Canada and the United States is not overly accurate. The other thing is it doesn't test for all the strains, and it doesn't test for a lot of the co-infections unless your medical doctor does that. So just on a little bit of a side note, I mean, you could get bit by a tick and get 3 or 4 co-infections, which mimic Lyme disease, but not necessarily Lyme disease itself. And that's why, it doesn't come back positive in the testing itself. Okay, so what happens when you actually get all of these symptoms and pain and all of this weird stuff? The blood work's not showing anything, etc. I mean, if you suspect it, the best thing you can do is to go on antibiotics early. Now, kind of the gold standard of treatment, at least in adults, is doing doxycycline for about 2 to 3 weeks. In most cases, that'll clear up Lyme disease. Not always, but in most cases. In children, they would do another antibiotic because doxycycline typically does affect the teeth of developing children. It can kind of brown the teeth. And so they'll use something like amoxicillin. Now, of course, it'll vary depending on the doctor. And of course, you must take your doctor's advice on this. Don't take my advice on what is the best medication. But I'm just kind of giving you what kind of the gold standard is in the medical instruction books and how it's usually approached. So if you're lucky enough to get it during the right time period in terms of the testing and the treatment, likely it'll be taken care of. If you're not, this is going to turn into something called chronic Lyme disease. And this is where it gets tricky because with chronic Lyme disease, you have a hard time actually testing for it. The testing becomes less accurate over time. The other thing is once it settles into those tissues, it is very hard to get rid of. And remember, we talked about this autoimmune thing where the body has to attack itself in order to kill the bacteria. And so, even if you kill the bacteria off, sometimes the immune system can get used to attacking itself. And when it gets used to attacking itself, it will create an underlying or an autoimmune disease. And so, you can get things like thyroid issues, you can things like MS like symptoms, Parkinson's like symptoms, you could get chronic fatigue and fibromyalgia. These are kind of some of the diagnoses that get thrown around with kind of a chronic Lyme disease or a post Lyme picture. And so the important thing is you have to get properly tested to see if you still have it, because if you do, it has to be killed off. And then once it is killed off, you need to seek the advice of a functional medicine doctor, an integrative medicine doctor, a naturopathic doctor like myself, somebody who can help kind of calm your immune system down and advise you how to get it back on track. Now, that recovery period, once you've been treated, if you get the antibiotics early, the recovery can be quick. It can be within a couple of weeks. In a chronic Lyme scenario, I would say the average amount of time of active treatment is anywhere from 7 months to a year. And with a lot of patients where that disease has not been diagnosed and they've been suffering for years and years, it can be up to 2 years. My general rule of thumb is about 1 month for every year that you've been suffering with it. And so that's not the case with everyone, because there's always these outlying factors that we'll talk about in a further discussion, such as mold exposure, environmental exposure, hormone issues, heavy metal toxicity, chemicals. All of these things can have an impact on how well your immune system actually can respond and fight off these infections. And so it's really important that if it does evolve into a chronic state, that you do seek the advice of a Lyme literate doctor. And many of them are available if you search the ILADS, that's ILADS, which is the organization for Lyme literate doctors in North America here, and actually the world. And you can search up doctors there that should be able to help you on your journey back to health. Now, is it possible to heal from Lyme disease? For sure. Is it easy once it's in the chronic state? It's not easy. But what's really important is that you get the advice of someone that knows what they're doing, and they can help you on the journey. And you have to have realistic expectations of how long it's going to take to get better. Because honestly, once it's settled in, it's very difficult to get rid of. Now, if you want to learn more, please subscribe to the channel. Please like, follow, comment. I appreciate all of these things. And we'll be back to share more information in the near future about all of the complexities of Lyme disease and co-infections and all of the complicating factors like environmental toxicity. Stay tuned.